Module 32, the concept of trauma. There's quite a bit in here. We're not going to do mod exemplar B, multi-system trauma, because you'll cover that in MedSurg 3. Okay, but there's a lot of information. It's a lot of slides because I tried to break it up and make it easier to remember. Trauma result from an event or series of events. Its lasting effects on individuals' functioning and mental, physical, social, emotional, or spiritual well-being. One common nursing implication: assess and monitor for safety. The nurse ensures that every trauma patient has a supportive, safe environment during care, and be culturally sensitive. Page 2105, that's the beginning of this module. So 2107, interpersonal violence represents all instances of abuse, family, intimate, community. It's when the violence is not for the purpose of any good. This violence accounts for 10% of traumatic brain injuries. It can be brain injury from shaken baby syndrome, partner child mistreatment, and gunshot wounds. Violence may result from a blunt or penetrating trauma. Blunt trauma is on the outside. It does not penetrate inside the tissue. Penetrating can be gunshot, stab wounds, impalement. Any type of violence leads to stress, and stress can lead to depression with anxiety, anger, and aggressive outbursts. Sustained abuse or neglect or some type of violence leads to the stress response. I think that's it. Okay, let's see. So there's different types of abuse. Physical is you look for unexplained injuries, bruises, or fractures. This is on 2108. A neglect shown by poor hygiene, lack of medical or dental care, poor growth and development of the child, weight loss of dependent or older adult, because it doesn't just happen to children. Sexual abuse shown by a knowledge about sexuality or related topics inappropriate for their age, or minors with pregnancy or sexually transmitted infections. Emotional abuse can be evident by no identifiable injuries, but they're socially withdrawn, apathetic, diminished self-confidence, diminished self-esteem. Complex trauma or interpersonal trauma that generally begins in childhood. Traumas occur repeatedly and become cumulative. It can be direct harm such as severe abuse, neglect, abandonment, or exploitation. Still on page 2108. Child abuse, act or failure to act by the child's caregiver that results in death, serious physical or emotional harm, sexual abuse, exploitation. And it can be any type of that. Nurses must continue to assess for signs of abuse when caring for patients, especially patients in the vulnerable populations of the children, older adult, and disabled. And this child is any child that's considered a child if they're under the age of 18. And their caretaker is somebody in a custodial role. Evidence of child abuse, it's equal number of males or females. And here's just some information I thought was a good slide. Okay, and you have your physical assessment there on page 2109. Elder abuse. Page. That child abuse was in exemplar 32A page 2126. And then elder abuse is on 2128. Women are more often the victims. Up to 10% of older adults experienced elder abuse in 2011. Estimated that only 1 in 14 cases are reported due to unwillingness to report family members' physical or mental inability to report, fear of retaliation from the abuser. And it can be every type: physical, sexual, emotional, psychological, neglect, abandonment, financial, or material. And the perpetrator is typically a trusted caregiver. Consequences of elder abuse are decreased health, increased risk for mortality, hospitalization, possible nursing homes, and then there's abuse in the residential care facilities. Most commonly, it says relatively uncommon, and most commonly verbal and psychological, but there's been some stuff in the news lately of some pretty blatant elder abuse in nursing homes with unrelated people. Signs of physical abuse. You have physical manifestations of physical abuse, 2128, 2129. I just simplified that whole thing, and there's some pictures, figure 32-2, withdrawal, all age groups, withdrawal from friends, less overt symptoms, behavioral changes, depression, suicide. Children and teenagers may miss school, more recognizable or unexplained injuries, bruises. Incongruence between injury and explanation is a red flag. And then you have neglect, back on 2108. Abuse and neglect on the first column there. Poor hygiene, lack of medical or dental care, poor growth, development, weight loss, in dependent or older adults. Some behavioral issues, stealing food, apathy. Neglect is an important assessment whenever you're doing any type of physical assessment. Symptoms may present differently depending on age group and population. More than 3 million suspected child maltreatment cases reported each year. Almost 700,000 are confirmed, 800,000 are hospitalized because of violence. And there's sexual abuse, which can happen in children, but it can happen in all ages, and it even happens with elder abuse. This is listed also on page 2108, differs from sexual assault, which is forced. Sexual activity resulting from being lured by a person who's perceived power over the victim, is usually compliant, may be protective of the perpetrator. Sexual abuse includes forced sexual intercourse, sodomy, child molestation, incest, fondling, attempted rape. All individuals are at risk regardless of their gender, age, education, IQ, socioeconomic status. The perpetrator is usually known by the victim. It's also consistent across all demographics. Signs and symptoms of sexual abuse. There's the overt, which are blatant, like minors who present with pregnancy or sexually transmitted infections, but non-overt: depression, anxiety, fear, nightmares, eating disorders, withdrawal, and distrust of adults. Emotional abuse. Emotional, it's tough because you don't see it. Social withdrawal, apathy, diminished self-confidence, not feeling well, unexplained headache, and stomach ache. Stomach ache is a big one in children. Symptoms may not be easy to identify because there's no physical manifestations of it. They have psychosomatic issues like not feeling well and stomach aches. The pattern behavior warrants assessment. And assess for domestic violence. Assault. Physical assault is on page 2109. It could be a simple attack where a weapon is not used. usually doesn't result in serious physical injury. There's aggravated assault, attack with a weapon regardless of whether injury occurs. And a rape is a non-consensual penetration orally, vaginally, or anally. It can happen in rape trauma syndrome and sex trafficking. Homicide is an unlawful act that results in death. There are 42 million trauma-related visits to emergency department and 2 million hospitalizations a year. Risk factor theories. These are over on etiology. Risk factors, page 2124, 2125. The genetics may increase the risk of violence. Environment is often a cofactor. So there may be an underlying risk there and other things that contributed to. So genetics is a neurobiology theory. Genetics believed to play a role in anger modulation and emotional control. Then there's the psychopathology theory, suggests some people participate in family violence as a result of personality disorders or mental illness. Although most of these people are not actually violent. Social learning theory, individuals learn violent tendencies through association with others and reinforcement of abusive behavior. Children are especially susceptible, childhood history of abuse or neglect. Some other things are risk factors are low IQ, substance use or abuse, history of early aggressive behavior, deficient in cognitive and informative processing, exposure to violence and conflict in the family. Women are 4 of every 5 victims of interpersonal violence. Having a criminal father figure, coming from a disruptive family, poor parental relationships, impulsive behavior, and aggression. All these things are predictors of greater risk for violent behavior later as an adult. More risk factors that are listed in your text, 2124, 2125, are listed here. Younger children and older adults are more likely at risk for being victims. Testosterone correlates with higher aggressive levels in humans, so young male abusers typically have high levels of testosterone and low levels of serotonin. Physiological development, illnesses, and disabilities leave those people at higher risk to be abused, victims of abuse. Socioeconomic poverty is the largest risk factor and predictor of child abuse and neglect. Substance abuse is one of the leading risk factors for perpetrators of all forms of abuse. Alcohol can contribute to aggressive behavior. Firearms, 68.5% of all weapons used during all murders were handguns. Community violence, page 2110. Turn to that. Community and system violence, so community violence, workplace violence, school violence, okay. Predatory violence such as robbery, it's not done by family members, hate crimes, gang-related violence, rapes, stabbings, shootings, beatings. Okay. Workplace violence, page 2111. Unfortunately, it's a big part of nursing, which is sad. I hope you guys can make changes. Majority are aggravated assault, horizontal violence, lateral violence. Horizontal, lateral, hostile or aggressive behavior by an individual or a group toward other group members. Most incidents don't result in mass fatalities. Majority were aggravated assault, horizontal violence by an individual group toward other group members, and usually not violent. Usually it's bullying, and that's prevalent in nursing. So that old saying of nurses eat their young, unfortunately, still exists. School violence, bullying, mass shooting incidences, children, increased risk of mental illness, suicide, poor school performance, sexual and physical violence, passiveness, spreading malicious rumors, encouraging others to shun or alienate. Victims of bullies have increased risk of suicidal behavior and negative emotional outcomes. Cyberbullying is done with technology, text messaging, emailing, cell phone. Technology allows bullies to be anonymous. It's terrible. Unintentional trauma are things like motor vehicle accidents, drownings. These are a trauma, but they're not intentional, as we're discussing in the others. Alterations related to trauma, 21, 13, and 14. There's the chart alterations and therapies. So with a physical injury, you want to assess and identify physical injuries, A, B, C, D, E. That's the order. You do A, then B, then C, then D, then E. That will be covered much more in MedSurg 3, but it's airway, breathing, circulation, disability, environment. So you don't get to feel their pulse until you know they have an airway. Don't see if they're breathing until you know you have it. It's airway and then breathing, and then circulation, your pulses, your volume, your urine output. Then D is disability, your neurological, your moving extremities. Your E is your environment, too cold, too hot, wet things on, burns, that sort of thing. Emotional injury, assess their emotional injury support groups, community support. They may need pharmacological agents, relaxation techniques, mental health counseling. Loss of community, ensure safety, shelter, food, water, complicated grief, psychotherapy, cognitive behavior therapy, antidepressants, which are things that we've covered in previous modules. Factors impacting response, predisposing, vulnerability, risk, precipitating. Families can be a predisposing factor. Individual risk factors such as preoccupation with danger, history of abusing animals, bullying. Psychological factors, aggressive tendencies. Female more likely to have extreme reactions, and traumatic response more prevalent in people aged 40 to 60. Protective factors, see 2116, the bottom, there's some bullet points there that I pulled onto here on your slide. Success in school, positive social relationship, parents' interest in children experience, community involvement, family activities, culture, religious, strong emotional support, which is what we've really built on in prior modules. Promoting safety. It's on the same page, 2116. It's a long paragraph. I just broke it up, knowing the warning signs, protective measures. Warning signs, uncontrolled anger, threatening language, aggression, protective measures, not walking or running alone in deserted areas, asking for help when being abused, reporting violent behaviors, abusive situations. Promoting healthy community, change roots of negative behavior in home, schools, community education about abuse, bullying, neighborhood violence, high school curriculum adding dating violence, overall safety, youth centers offering healthy recreation education. In community settings, dispel myths about aggressive abuse, assure patients it's never okay for somebody to control or injure them. Assessment. It's under your nursing assessment. Assess will depend on the nature and extent of injuries. Look for physical and mental issues. Consider their cultural, spiritual. Always begin with ABC, airway, breathing, circulation. Abuse assessment on the bottom of page 2117. 2118, it actually puts it in bullet points, which I get to in next. So I'm starting on over here on page 2117. Ensure privacy and safety from perpetrator. Be professional, calm demeanor. Allow them to answer sometimes or maybe instead of always yes or no. Get a detailed history and description of current symptoms. Nurse may be the first person to discover the patient has been abused. Some victims may not disclose abuse and deny it despite obvious symptoms to minimize the impact. Treat everybody on a case-by-case basis. Do not stereotype. So then over to 2118, the bullet points I have on here. Head looking for bald patches where hair's been pulled out, evidence of trauma from blows to the head, petechiae around the eyes. Your skin, you're looking at swelling or tenderness, bruises, burns, scars from past injuries. Look on their skin, their genitals, and the rectal area. Musculoskeletal fractures or evidence of previous fractures, dislocated joints. Abdomen, bruising, wounds. Assess for intra-abdominal injuries, especially if the patient's pregnant. Neurological, hyperactive reflexes, paresthesia, numbness, pain from old injuries. Not on here is your physical manifestations. I said injuries to genitals, anus, swollen genitals, bladder, kidney infections, sexually transmitted infections, pelvic inflammatory disease, and unintended pregnancy. Cultural considerations. I did this because pictures speak 1,000 words. This will be on NCLEX. So you need to recognize cultural things such as cupping or coining. This is cupping. Cupping is a healing treatment that causes marks on the body that can be misinterpreted as signs of abuse. Some acts that are acceptable in one culture are not acceptable in the Western culture, such as hitting wife for disobedience, physical punishment of children. Traditions of punishment may be passed down to the family. Parents may not see injuries to child as inappropriate. Nurse must fulfill the duty as mandated reporter of child abuse. So no matter what is said, you have to report. Okay, abuse, head trauma, 2126. I'm looking for that. Oh, under infant abuse. Shaken baby syndrome, highest prevalence of fatality due to physical abuse, occurs in as little as 5 seconds. May also cause damage to neck, spine, and eyes, not caused by gentle bouncing. Fall or accidental dropping causes a different type of trauma, not AHT or abusive head trauma. What I mentioned earlier, where you're looking at the genitals, it's a physical assessment for sexual abuse. This is on page 2129. Yep. Over on the right-hand column, patient may be withdrawn or combative, may act out due to guilt, anxiety, depression, suicidal thoughts. These are fearful. This can happen at any age, including children. If children have early sexual knowledge and interest in sexual acts and developmental regression. Warning signs of a perpetrator. These are important because you need to keep your patient safe, you need to keep yourself safe. Ignoring social, emotional, physical boundaries, oversharing adult issues with child, overly interested in sex of a teen. If nurse observes such behavior in an older teen or adult, assess further, exposing child-adult sexual interaction. These are things to be alert for and to do with education so people understand. And I just realized there's pictures for the cultural. No, never mind. There's not. Manifestation of neglect. This starts on the bottom of page 2129 into 2130. If neglect is suspected, a nurse should conduct more in-depth assessment. Untreated diaper rash, dirty diapers, poor hygiene, poor eye contact, failure to thrive, skin sores, flea bites. And I did think I saw this, but I mentioned cultural considerations back in a previous slide. It's over here on page 2130. It has pictures of cupping and coining, which is not abuse, I had cupping done a couple of times with Chinese School of Medicine when I was in Florida, and I got so scared that somebody was going to report my husband for abuse, but it was wonderful. It worked beautifully. Okay, manifestations of neglect varies with age. So the previous one, these are manifestations in an infant, manifestations in a child: poor hygiene, dirty clothing, clothes too small, appears hungry or presented with no lunch, untreated medical dental issues, bug bites, not reaching developmental milestones. Older adult manifestations: unexplained weight loss, dehydration, poor hygiene, untreated medical issues. Neglect is the most common form of abuse of the older adult. Independent interventions the nurse can do for victims. This is back on page 2119. Independent interventions for victim. It goes into 2120. Assess for immediate danger. Assess for life-threatening injuries. Reinforce victim is not to blame. Assure the right to safety. Establish trust and relationship. Explore options for help. Provide information and available resources. Do not require a child to repeat the story for multiple reports. Each retelling can cause trauma to the child. Follow standard protocols. Important to shift control to patient, even if they're a child. Do not lie or make false promises. 2119 and 20. Independent interventions for an abused child. Convey belief in child story. Do not make child repeat it. The things I just said. Independent interventions for abused older adult. Develop positive relationship. Explore need for additional home care services. Explore ways adult to maximize independence. Collaboration. Diagnostic tests may include X-rays, MRIs, CAT scans, ultrasounds, DNA swabs for sexual abuse, tests for sexually transmitted infections. Need to get diagnose the depth of injury. Pregnancy test. Pharmacological therapy can be pain meds, sedatives, anti-inflammatories, antibiotics, something for infections, fluids to correct fluid volume deficits, tetanus boosters, other vaccines, medications for post-traumatic stress disorder. Physical effects of abuse will heal long before the emotional effects will fade. Now we're going to get into exemplar C. We're skipping B. We're going to go all the way to C, post-traumatic stress disorder, which starts on page 2146. Etiology, factors that contribute to development, multiple things: wars, violent personal assaults, motor vehicle crashes, imprisonment, dismemberment, incest, threats of violence or injury. Childhood traumas, molestation, history of psychiatric disorder, lack of emotional support or resources during the trauma. Incidence increases when traumatic brain injury is also present, which is significant in soldiers. We got the picture there on page 2147. Pathophysiology, fear-based re-experiencing of the event may include flashbacks, dysphoric mood, negative cognitive states. Some people experience acute stress in the immediate aftermath, may result in acute stress disorder. This shares some factors to post-traumatic stress, but that is an acute state. Post-traumatic stress is a long, prolonged duration. Risk factors, individuals of any age, any culture group may develop it. Its severity of the event, additional stresses immediate after, pre-existing mental illness, little or no psychological support. Incident higher among military veterans, law enforcement officers, firefighters, emergency medical personnel. Risk factor includes whether the person was harmed or just saw others harmed or killed. Clinical manifestations, page 2148. Depersonalization, hyperarousal, hypervigilant, extreme anxiety, strong sense of agitation, disassociation, aggressiveness, violence, emotional numbness, may further impair their social interaction leading to isolation, depression, alcohol abuse may occur within 3 months of the traumatic event, or it may occur years later. Depersonalization is emotional numbing, loss of sense of reality, feelings, and self in relation to others. Things formerly enjoyed may provide no pleasure, may express uncharacteristic irritability, aggression, and violence. Nursing interventions, priorities. These are on page what? Assessment. Look at implementation 2151. Ensuring safety of patient and others, quickly lowering patients' anxiety. For patients with extreme anxiety, immediate pharmacological interventions, quiet, calm environment, reassurance. When anxiety levels are reduced, team can help patient learn new appraisal and coping measures. Pharmacological, there's your sertraline, paroxetine. Both of those are SSRIs. That's your Zoloft and Paxil. Prazosin, one of your anticholinergics. Amiodarone goes prazosin. It's always what pops in my head because it makes you drowsy and postural hypertension. Anyway, non-pharmacological, there's eye movement desensitization and reprocessing, EMDR. I've seen some people do well with that, some not. Exposure therapy, I don't agree with. Anyway, exposure therapy, gradual exposure to elements of traumatic event, enabling patients to face fears. I don't think that's effective, but that's my opinion. Acupuncture, regular basis for at least 3 months. It's an adjunctive, does not replace cognitive behavior therapies. These are all on 2149 under collaboration, sorry. PTSD in children. This is 2150. Children less than 6 years of age may re-experience trauma through play, may behave restlessly, aggressively, may withdraw, mood changes, nocturnal enuresis after they've already been toilet trained. That's the regression. Forgetting how to talk, regression. Acting out, traumatic event during activities. I've seen that. Being exceptionally needy or clingy. PTSD in older adults, page 2150, may minimize the significance of the trauma. Older veterans may report more somatic symptoms and fewer typical PTSD symptoms. Know that. Increased risk for suicide and cognitive screening. 70 to 90% of adults over 65 have experienced at least one traumatic event in their lifetime. They show less hostility and anger, but higher suicide risk. Assessment 2150, 2151. Specific interview questions are aimed at re-experiencing flashbacks, hyperarousal, exaggerated story response, sleep disturbances. Assessment of children involves questioning the child and parents about significant changes in behavior and sleeping patterns. Implementation, reinforce understanding of effective coping strategies, understand PTSD has profound impact on social, interpersonal, occupational, and it can occur at any point. It can be years later. Assist in connection with community resources and organizations. Not everybody will develop PTSD. Evaluation, patient use of self-calming techniques, patient experience fewer cognitive distortions, decreased time spent ruminating over worries, verbalizes more accurate prediction of future events. Okay, rape and rape trauma, 2154. I'm not sure if this was covered. I don't think it's covered in maternal child, so I'm going to cover it here. I was hesitating, but I really don't think it was covered there. Okay, there's different types of, there's rape, acquaintance rape, marital rape, rape trauma syndrome. Acquaintance rape is committed by someone known to the survivor. Marital rape, spouse forces sex. It's a crime in all 50 states, and it does happen. Rape is a penetration, no matter how slight, of the vagina or anus with any body part or object, or oral penetration of a sex organ by another person without the victim's consent. The largest amount of the rapes occur on college campuses. Rape trauma syndrome, a series of psychological sequelae that many individuals experience following rape, in addition to physiological sequelae. These are in your overview section here on page 2154. Teaching related to date rape drugs. This is our responsibility to educate. Date rape drugs like Rohypnol, GHB, ketamine, all are colorless and odorless and can be added to a victim's drink without detection. Can be fatal when mixed with alcohol. So do not accept pre-made drinks. This is what you teach people. Do not leave a location if you're alone with someone you do not know or completely trust. Page 2154 to 55, pathophysiology, etiology. Rape can occur in a number of circumstances, can include physically violent element, psychological. Survivors need to heal emotionally and physically. May feel as though they have little or no control over what happens to them, may feel as though they lost part of themselves. Fear and guilt. 1 in 5 women and 1 in 70 men have reported being raped in their lifetime. 42% of female victims were first raped before the age 18. 27% of male victims reported being raped before age 11. Clinical manifestations, page 2156. Oh, there's your patient teaching on your date rape drugs on the bottom of page 2156. Clinical manifestations. Let's see. Oral, vaginal, anal injuries, semen not belonging to the victim, possible physical injuries, psychological symptoms of shock, denial, confusion. Varies depend on the gender of the assailant and the victim, and physical violence during the rape. Internal injuries include bleeding, there can be long-term physical complications like pelvic or back pain, frequent headaches, GI disorders, pregnancy complications, sexually transmitted infections. Also, headaches, GI upset may result from stress as well as injury, physical injury. Immediate response is page 2157. They'll be hesitant to trust others, especially those of the same gender as the attacker. May be necessary to have healthcare provider of same gender as the survivor. Often wants to shower or wash away the incidents. Advise the patient not to shower before being examined, because it would remove potential evidence. The appearance of outward calmness may be the effect of shock and denial, not that it didn't happen. Treat patients as sensitively as possible. Long-term response, page 2157. I just took that paragraph and put it in bullets. Anger, flashbacks, avoidance of previously enjoyed activities, insomnia, eating disorders, sexual dysfunction, possible pregnancy, unhealthy coping, negatively to being alone, make cut emotional ties, depression, suicidal thoughts. Cultural considerations on page 2157. Cultures that demonstrate male superiority value women's thoughts and rights, likely not to consider rape of a female a matter of great importance. Not all members of a culture will have the same beliefs just because that's a culture belief. Individuals in the sex industry can also be raped. Just because they're a prostitute does not mean they cannot be raped. If the person states an unwillingness to continue and the other person does not stop, the act becomes rape. Rape trauma syndrome. Page 2158. You will see that Trying to find it on here. I wrote 2158. During the acute phase, open expression of feelings, controlled style, compound reaction. Open expression of feelings, confusion, fear, crying, sobbing, pacing, hostility, inappropriate laughter. Controlled style is numbness, shock, disbelief, withdrawal. A compound reaction is reactivated symptoms of previous conditions such as psychotic behavior, depression, suicidal behavior, substance abuse. Outward appearance of adjustment, but emotionally they are not. Superficial renewer life activities, they're going through the act, but it's not deep. Periods of anxiety, fear, depression, guilt, isolation, and sexual dysfunction. It's a syndrome. The reorganization phase, anger at assailant, society, judicial system, survivor seeks family, professional support, need to talk to resolve the feelings. PTSD, if they're unable to recover. Collaboration with interprofessional care, law enforcement, mental health professionals, sexual assault, nurse, examiner, SANE nurse, victim advocate. It's important for a nurse to ensure that all policies and procedures are followed precisely and meticulous documentation. Rape kit specimen collection is not diagnostic collected for purpose of convicting rapists. Diagnostics and tests are sexually transmitted, testing for sexually transmitted infections, possible pregnancy, HIV testing at baseline, 3 months, 6 months, 12 months. Pharmacological therapy is emergency contraception, most likely to be successful if taken within 3 days of attack. Some individuals will be opposed to doing this. Nurses' role is to explain options and respect their decisions and treat for sexually transmitted infections. Non-pharmacological therapies are support groups, individual therapy, counseling, relaxation techniques, deep breathing, music relaxation, and imagery. I'm a biggie on imagery. Assessment, ensure their safety, comfort, empowerment of the patient, encourage of rape kit and counseling, assess emotional needs. Patient may choose not to go through everything. If patient agrees, explain every step, ask permission during exam, remain supportive of patient's decision, offer police involvement if patient chooses to file a statement. Short-term goals, short-term less than 6 months, long-term greater than 6 months. Receive physical treatment for physical injuries, participate in follow-up care. This is all page 2160. Long-term goals, gain control over remembering, decrease flashbacks, work toward ability to name feelings, feel them, endure them without overwhelming, gain mastery over symptoms, connect with others, and discover or attach meaning to event, and finding empowerment. Implementation, assure the patient's safety, no judging or making assumptions, provide emotional support, pain medication as needed, determine whether the patient has showered or changed clothing, work with patient to relay details of incident. If patient chooses to have evidence collected, explain every step of the process, inform patient that patient can ask to stop at any point. The SANE nurse typically involved, SANE, S-A-N-E, sexual assault nurse examiner, and empower the patient, provide referrals to social workers, counselors, support groups, law enforcement, explain options for seeking help, educate patient on importance of developing safety plan before discharge, assist in development, evaluate their expression of emotion, empower to take control of the development. And I had to put that picture because I thought it was perfect. And that's the end of this recording.